Welcome everybody. In today's video, we're going to continue our PA Study Buddy series of EOR exam 50 high yield rapid review questions, and today's video is all about internal medicine. So let's begin. So first thing first, let's look at a typical exam question and why the high yield information is super important. What I used to do is I would read the whole questions. By the time I get to the answer, I would forget half the things that are in the middle. So what I started doing was I would read the last sentence first. So with that in mind, I will look at over the answers, and that way I don't get tripped with the stem, and I will be able to focus better and save on time. So in this particular question, we're going to have which of the following organisms is the most common cause of pneumonia in this patient? As you probably experienced by now from your didactic here, a lot of the questions in the EOR are not much different than your school. They're going to be asking what's the most common cause, what's the next best step, what's the best next exam, what are the side effects of this drug, and so forth. So those are the high yield questions that I organized and that can help you study faster, save time, spend time with your family instead of studying. So which one of the following organisms is the most common cause of pneumonia in this patient? Chlamydia, Klebsiella, Mycoplasma, and Streptococcus. So with that in mind, I would start reading the question. And usually I would have my answer within a couple of sentences. An elderly man was brought to the ER by EMS in acute respiratory distress, acute onset of fever, altered mental status, left pleural chest pain, and cough that is productive. EMS states that a patient was picked up in a park, found next to a couple of empty bottles of hard liquor. So patient is an alcoholic, and right there I have my answer. I know Klebsiella is the most common cause of pneumonia in alcoholic patients. Patient has a strong alcohol odor. As you approach him on exam, you note rales, dullness to percussion, and increased tactile firmness over the left lung. So you can see how known high yield info can significantly improve your scores. So now let's continue and start this video. Unstable angina versus NSTEMI. How to tell the difference between the two? Well, with unstable angina, we'll have normal biomarkers, where with NSTEMI, you will see elevated biomarkers. That's the easiest way to tell them apart and not get tripped by the stem. Question number 2. CABG indications. For CABG to be performed, you'll need a left main coronary artery disease, symptomatic 3-vessel disease, and a left ventricle ejection fracture less than 40%. So for CABG, they can list different things. What you're looking for is a left main coronary artery disease. You're going to look for either 3-vessel disease, and you're going to look for a left ventricle ejection fracture less than 40. Every one of those is indicative for CABG. Question number 3. What if it's only 2 vessels? So they're going to give you a stem instead of 3 vessels. They're going to name 2. And the answer for that will be PTCA, percutaneous angioplasty. So you can see how they can get creative with the questions. They can give you a CABG answer. They can give you a percutaneous angioplasty. So you're just going to see how many vessels they are. If it's 2, if it's percutaneous angioplasty. If it's 3, the patient is ready for a CABG. Stable angina treatment. PANCE. So also another thing that may help you during your EOR study is to create little mnemonics off of your study guides, or I also like to create little stories to help me remember material better. Some people like different kinds of stories, so whatever works for you, you can use mine, you can use someone else's, you can come up with your own. Whatever works, just keep going. So stable angina treatment, PANCE, beta blocker, aspirin, nitrates, and statin. What is SIRS criteria? This is a typical question you'll see on your exams. You also might be pimped on these questions. So the SIRS criteria is a temperature greater than 38 degrees Celsius or less than 36, white blood count greater than 12 or less than 4, heart rate greater than 90, and a respiratory rate greater than 20. Consider infection, you'll need 2 out of 4. So if you have 2 out of 4, you're going to be considering an infection, and the SIRS criteria, again, it's really typically tested question because it's easier to create a question around this. Most common cause of myocardial infarction, most common cause of MI. That would be atherosclerosis. So you're going to tell your patient had an MI, all these different symptoms the patient had in their past, and they're going to ask you which one of these is the most common cause of the MI, and your answer should be atherosclerosis. What lactate level indicates sepsis? So this is a common question we pimp our students on our ICU rounds. So the what lactate level indicates sepsis, and that would be greater than 4. Bradycardia, so low heart rate less than 60, plus chest pain may suggest what? It may suggest inferior wall MI. So you're going to have a question stem, going to go to a patient that has bradycardia, is going to be coming in with some chest pain, and they can list all 4 different parts of the EKG and ask you which one of them might be the most likely affected, and your answer should be inferior wall MI. Inferior wall MI will affect which vessel? It's another question they can ask. They're going to tell you a patient comes in with the bradycardia and a chest pain. They may not even tell you it's inferior wall MI, and they may just ask you in which part of the EKG or which vessel you should be seeing changes, and that would be RCA. Question number 10. Septal wall indicates which vessel? See how they can play with the different vessels and different parts of the wall when creating a question. So the answer is LAD. Septal wall indicates which vessel, and the answer is LAD. Alright guys, so all these questions I have organized in my book. There's over 3,800 questions just like this to can significantly help you increase your scores in a EOR. So please do go check it out. The book is only $20 on Amazon. So check it out. Let me know what you think. Leave a comment. Let's continue. When does the troponin peak? This is another really easily tested question, or it could be a pimping question. They can give you different time frames. So knowing what time frame the troponin peaks is important, and troponin peaks within 12 to 24 hours. Cath lab uses which anticoagulation? Cath labs use unfractional heparin. And sometimes, like I already mentioned, sometimes making the little stories can help you remember stuff better. And I just say the UFO was found in a cath lab. UFO, so UFH is the closest thing I can think of it. So UFO is in a cath lab. I just imagine like a big UFO sitting in the middle of the cath lab. And when they ask me about anticoagulation in the cath lab, I just think UFO, UFH, unfractional heparin. I never forget that. In the cocaine-induced MI, avoid the use of which medication? So they're going to tell you, patient came in, he had a great time in Vegas or something, he was on cocaine, ended up having an MI, and they're going to tell you of which of the following is not a proper medication to treat this patient. And your answer is always beta blocker, because beta blockers, they increase the risk of vasospasm. They may also be super creative with the question, and they may ask you, with the cocaine-induced MI patient, what's the reason of not using any of medications? They may list beta blocker, some others, and ask you for questions like XYZ, but the answer should always be vasospasm, increased risk of vasospasm, and beta blocker. Beta blocker, cocaine did not go together. Cocaine-induced MI isn't fun. Beta blocker and in LOL, don't use them. Cocaine-induced MI isn't funny. Cocaine-induced MI is not funny. That's not the way I remember this. Cocaine-induced MI is not funny. LOL. Beta blocker, they all end in a LOL, like metoprolol, so do not use them. So why avoid beta blocker? Unopposed alpha-1 constriction. So they can give you a question stem, and they give you all this different reasoning why not to avoid beta blocker, and the correct answer is unopposed alpha-1 constriction. So you guys can see how they can get creative about questions, how they can try to trip you. So why reading that last sentence first, looking over the answers. Sometimes you can recognize the disease by just looking at a question and answers, but you know, just be careful, read the stem, and you should be able to pick up a right answer if you got your high yield information down right. In which patient population is normal to see sinus bradycardia. So it is normal for athletes. All of the athletes, they have a low heart rate, and they may ask you a question. Patient comes in with a heart rate of 50, and everybody is like worried about bradycardia, but which one of these should not be a high risk? And it says patient is an athlete. Treatment for sinus bradycardia. So treatment for sinus bradycardia is atropine. We always in ICU, we always have this on the bedside after certain procedures, just in case the patient becomes bradycardic. So atropine, I remember this as atropine. Atropine sounds like rope. Atropine. Atropine, rope. The only way to stop Tom Brady is to rope him. Tom Brady, Brady for bradycardia, rope for atropine. Because other medications, they don't have the rope in it. So you should be easily able to select it and pick it out from the rest. So atropine sounds like rope, and the only way to stop Tom Brady is to rope him. I'm not a big football fan. I just think this is relevant, so I just remember it. Fever can cause which sinus rhythm? Patient comes in with a fever. They're going to give you all different rhythms, and they're going to ask you which one of these is most likely related with fever, and your answer is sinus tachycardia. If patient is tachy, fever was likely associated with it. Sinus tachycardia treatment. So they're going to tell you a patient has a fever, comes in with a tachycardia, and they're going to ask you what is the proper treatment for this patient, and your answer is metoprolol. This is also another really question we get pimped on a lot in ICU. So for all our tachycardic patients, we use metoprolol. Funny fast heart, LOL. LOL in a metoprolol. Funny fast heart. Sinus tachy. Heart rate greater than 100. So it's fast heart. Funny fast heart. LOL metoprolol. Sick sinus syndrome treatment. So sick sinus syndrome treatment is pacemaker. And the way I remember this, that is one sick sinus, sick heart, and it needs a pacemaker. So sick sinus syndrome, they may tell you patient has a sick sinus syndrome. They may ask you to pick it off the EKG. They may give you EKG findings. They may give you heart rate findings. And they may say, what is the right proper treatment for this patient? And your answer should be pacemaker. So every time I see a sick sinus, I would think to myself, that is a sick sinus, sick heart, and it needs a pacemaker. Second degree AV block most commonly occurs where? So second degree AV block most commonly occurs in a bundle of His. So they're going to give you all different parts of the heart. They're going to ask you what is the second degree AV block most commonly found at, and your answer is bundle of His. And the way I remember this, that's his second block. So everybody talks about a second degree AV block, and all I can think of is that's his second block. Bundle of His. That's his. Bundle of His. That's his second block. The definitive treatment of atrial flutter. So this is the definitive treatment, not the next treatment. So this is the best treatment. Sometimes in a question, you gotta see if what's the next versus what's the best. So don't let that trip you either. So the definitive treatment of atrial fibrillation is radiofrequency ablation, RFA. And by the way, guys, all of these questions, the high yield questions, they're super important because this is something you're going to be pimped on a daily basis as a student in your rotations. If your preceptor's care, they like to pimp because that's how they teach, that's how they were taught to. And if you know all this stuff, you're going to be looking like a stellar student, and it will also help you study for your EOR. Question number 22. Rate control in patient with the A.Fib and hypotension or congestive heart failure. So the question then will tell you the patient is in A.Fib and they're hypotensive or they have congestive heart failure, and the rate control is digoxin. So digoxin is used for patients that are in A.Fib with congestive heart failure, If you want to obtain the rate control in the A.Fib and the hypotension, use digoxin. Is rate or rhythm preferred as the initial treatment of A.Fib? This is a pimping question for sure, and a question stem. They can get creative around this question with making you realize there's a patient in A.Fib and what's the next best step, and your answer is always rate. Rate over rhythm. Wolff-Parkinson-White accessory pathway is. Once again, they can give you different parts of the heart, they can give you different answers, and the Wolff-Parkinson-White accessory pathway is a bundle of Kent. And the way I remember that is I was like in a zoo, and I just remember seeing a wolf, and the wolf's name was Kent. So the Kent, bundle of Kent. So every time there's Wolff-Parkinson-White, wolf, I think of wolf named Kent. Wolff-Parkinson-White EKG will show what? Wolff-Parkinson-White, wolf named Kent, will show delta waves, short PR interval, and a wide QRS. But most notably, you will see those delta waves right out of the gate. What's multifocal atrial pacemaker, MAT? What's multifocal atrial pacemaker? That is a heart rate greater than 100 with 3 different P waves. If you see 3 different P waves on an EKG and a patient has a heart rate greater than 100, you should be thinking of MAT, multifocal atrial pacemaker. MAT is classically associated with which lung disease? So they can even skip the MAT in their question stem, and they're going to tell you the patient has a heart rate greater than 100. They're going to show you EKG. You're going to see 3 different P waves, and they're going to ask you what is the most likely associated disease with this. They may even say lung, and the answer is COPD. Heart rate greater than 100, 3 different P waves, COPD. Most common cause of torsade de puentes. The most common cause of torsade de puentes is hypomagnesemia, low magnesium. Low magnesium will make the heart twist. Endocarditis in the IV drug users, most common bug. So they're going to tell you a patient comes to the ED, they have a history of the IV drug use, you diagnose endocarditis, and they're going to ask you which one of these is the most common bug associated with this condition. They're going to list 4 or 5 different ones, and your answer is Staph aureus. Honestly, like Staph aureus is like really common to see across like IV drug users, and so having this on your differential is super helpful. So endocarditis, IV drug users, Staph aureus. Prosthetic valve, endocarditis, most common bug. So you can see right here how they can trip you. They can say the patient is XYZ, but they do have a prosthetic valve. Now they have endocarditis. So now what is the most common bug? And that would be Staph epidermidis. Staph epi. And the way I remember this is the prosthetic valve has no skin, no derm. Epidermatitis. Epidermidis. That's such a crazy word to say, epidermidis. Okay, there you go. I said it. Congestive heart failure, chest X-ray will show what? So they're going to give you a stem with a patient having different oxygen levels, all these different issues, and they may even just show you, or it could be a pimping question in your rounds on your internal medicine rotations, and they're going to show you a chest X-ray and say, what do you see? So the congestive heart failure chest X-ray will have those curvy B lines. You'll see those at down in claustrophrenic angles, the little lines. Patient may have that butterfly pattern around their heart, and there's going to be a lot of congestion. So there's not going to be a lot of lung visible. You're going to see a lot of congestion, a lot of like white throughout the lungs, and so you should be thinking about congestive heart failure. Fever plus new murmur should always make you think of endocarditis. So fever plus new murmur, think endocarditis. They're going to tell you a patient comes in, It has, a fever of like 104 or something like that. And on your physical exam, you notice a new murmur, and right on top of your differential should be endocrinitis. Only murmur associated with hemoptysis. Guys, I made a separate video on all of the murmurs, how to memorize them, how to differentiate them, just like a bunch of like high yield questions on the murmurs. So if you're interested, please do check that video out as well. So the only murmur associated with hemoptysis is mitral stenosis, MS, mitral stenosis, and you're going to see hemoptysis. And yeah, again, check out that video on the murmurs. You'll find it super helpful. Syphilis is associated with which murmur? So you're going to give you a stem where a patient comes in, they have a history of syphilis, and you're going to hear a murmur. They may tell you what the murmur sounds like, they may not, and they're going to ask you which one of these is the most likely one associated with syphilis, and that would be aortic regurgitation. And the way I remember that is, are you sure he has syphilis? So when we talk about syphilis, I always ask, are you sure he has syphilis? R, AR, aortic regurgitation. Are you sure he has syphilis? Treatment for pericardial tamponade. So pericardial tamponade is all that fluid around the heart, and it's treated with the pericardiocentesis. You gotta drain that stuff out. Hypertriglyceridemia can cause what? That would be pancreatitis. If you see the hypertriglycerides are greater than 500 on a lab, pancreatitis should be high on your differential. And if it's in a question stem, pericarditis is your answer. What is the contraindication for ACE inhibitors? Contraindication for ACE inhibitors in pregnancy. So they're going to tell you the patient is pregnant, they come in with hypertension, XYZ, and they're going to ask you which one of these hypertensive medications is contraindicated in this patient, and that would be ACE inhibitor. Most common side effect of calcium channel blockers, and that would be constipation. And the way I remember that is 3 C's: constipation, calcium channels. Constipation, calcium channels. CCC. Most common side effect of calcium channel blockers is constipation. In a question stem, you may see a question along the lines, patient comes in, they're on all these different heart medications, but now they got constipation. They're going to ask you which of the following medication is most likely a cause of his constipation, and that is calcium channel blocker, CCC. Which diuretic can cause gynecomastia? Again, they're going to tell you a patient comes in, they got gynecomastia, and they're going to ask you which one of these medications is most likely a cause, and that would be spironolactone. COPD patient under 40 could have what deficiency? They're going to tell you a patient comes in, they're under the age of 40, and they're going to give you a little longer stem with a bunch of fluff in it, and they're going to ask you which one of these is most likely deficiency in this patient population, and that would be A1 antitrypsin. Or they say patient has known deficiency of A1 antitrypsin. Patient is 35 years old, comes in with XYZ, they have a known history of A1 antitrypsin. Which one of these illnesses is most likely associated with this patient? And your answer should be COPD. Most common cause of bronchiectasis in the United States. And the most common cause is cystic fibrosis, and that is due to Pseudomonas. And I have this picture included because Pseudomonas is common in the hot tubs. So I try to include all these pictures, guys, for you, because maybe some of you guys are super visual like me. So some of these pictures might help you memorize things better. If it helps, great. If it does not, oh well. Here we go with the next one. 42. Pulmonary fibrosis treatment. That would be the lung transplant. Inhalation of mineral dust causes what disease? An inhalation of the mineral dust, they're going to tell you patient is working in mines, he's working on different things that has a lot of dust around it, but if it has mineral dust, it's causing pneumoconiosis. Pneumoconiosis. Swear to God, some of these words are so hard to pronounce. But you guys will get it. Like, whenever you get stuff, think of it to yourself. Thousands and thousands of students have graduated PA school before me. So can I, period. When it gets tough, say that to yourself. I said that to myself God knows how many times. Some of these long pharmaceutical words I still can't pronounce, so I make shortcuts for them, but it really doesn't matter. Once you get that PAC, you're good to go, baby. You just do you. So pneumoconicosis, coniosis, whatever, you select the right answer, you move on. Inhalation of mineral dust, pneumoconiosis. Silicosis is seen with inhalation of what? If you inhale silica dust, mining, granite work, they're going to tell you the patient is working like in a granite type environment. They're like cutting granite for work and they're inhaling a lot of dust. Which one of these lung diseases is the most common associated with granite related work? And that would be silicosis. A person that works with the fluorescent light bulbs can develop what? And that would be berylliosis. See how they can play with all these different like exposures to create all these little question stems. But if you know the light bulb, berylliosis, you know your silica, you know your like mining stuff, you will never get it wrong. What other jobs are associated with the development of berylliosis? And that would be the electronics, aerospace, ceramics, and dye industry. Patient works with electronics. Patient is an aerospace engineer, now has lung problems. You should be thinking berylliosis. Patient works in ceramics, dye industry, berylliosis. Hyponatremia is seen in which type of pneumonia? Patient comes in, chest x-ray shows pneumonia, blood work shows hyponatremia, and you should think of Legionella. Swamp coolers and related issues could be also in a stem. So if you see a swamp cooler in a question, Legionella is likely answer, but if you have hyponatremia and pneumonia, Legionella is the cause. Sarcoidosis treatment. To treat sarcoidosis, you need prednisone. Prednisone is a clear drug of choice. Few patients fail to respond. Sarcoidosis, prednisone. Which cell injury leads to pancreatitis? So they're going to tell you a patient has pancreatitis. They may give you a lab results that show pancreatitis, and they're going to ask you which cell injury is likely to lead to this, and your answer is ACNR. ACNR cells lead to pancreatitis. ACNR cell injury, I should say. The most common cause of chronic pancreatitis in children: cystic fibrosis and alcohol in adults. So when they give you a question stem, pay attention to the age of the patient because that could be the major differentiator. If it's a child with pancreatitis, it's cystic fibrosis. If it's an adult, it's alcohol. Alright guys, that brings us to the end. Once again, I hope you find this video helpful. Check out all the other videos on the EOR, high yield. All of these questions like this one and in all other videos, they come from this book of 3,800 last 3 cool questions that are super helpful right before you take your EOR. Check your knowledge, scan the bar. It's $20 on Amazon. Subscribe, help me grow this channel, and I'll see you guys in the next video. Thank you so much.